battling cervical cancer, or perhaps you've even been with loved ones who themselves are being screened, and that's fantastic. So as again, I'll say I'm Mia Keys. I'm with Hologic, and we are very excited to have this conversation in honor of Cervical Cancer Awareness Month. I want to be mindful that we also have representation today from the Congressional Hispanic Caucus, as well as the Caucus on Black Women and Girls. Before we go any further and I introduce our esteemed panelists and our speakers, I want to invite Isabel Sanchez, who serves as the Policy Director of the Congressional Hispanic Caucus, to deliver remarks on behalf of Chair Barragan. Welcome, Isabel.
Hey, good afternoon, everyone. Thank you to the hosts, Hologic and panelists, for organizing and for partaking in this important briefing on such a dire, critical issue. As it was stated at the top, cervical cancer is a disease that is treatable and preventable, yet many women continue to die of this disease because they're unable to get the healthcare that they need to prevent and treat this condition. The incidence of cervical cancer for Latina women in the U.S. is among the highest of all racial ethnic groups and almost twice as high as non-Latina white women. In fact, Latinas are 30% more likely to die of cervical cancer than white women. Latinas' limited access to adequate cervical cancer screenings is a result of barriers to access, such as fear associated with their lack of immigration status, embarrassment, lack of knowledge, lack of insurance, and lack of English proficiency. And so, unfortunately, 85% of women who die from cervical cancer never even had a pap smear, and that is why the CHC, including Chair Barragan, continue to fight to improve access to information for our communities, including access to healthcare, broadband access, and telehealth services to better identify and prevent such diseases. We look forward to this discussion today, and thank you to all for organizing and participating today. We hope that this is just a starting conversation to address a bigger issue. And if at any moment the caucus can be helpful to better partner and better fight this disease, we look forward to working with you all. I think it's important for us to continue to explore options to help reduce the toll of this disease on our communities. So with that, I'll pass it back to Mia, and thank you once again for having me.
Isabel, thank you so very much. And we extend our gratitude to Chair Barragan for the work that she's starting to do in this new congressional term. I also want to, and we of course know that the staffers are behind a lot of that work. And so we're really very grateful that you were able to join today. I want to invite Nisha Thanawala, who's the Senior Policy Advisor to the Office of Congresswoman Yvette Clarke, who is also the co-chair of the Congressional Caucus on Black Women and Girls, to deliver remarks on her behalf. Nisha, welcome.
Hi, thank you, Mia, and for the gracious introduction, and greetings, everyone. It's my pleasure to be here on behalf of Congresswoman Yvette Clarke, who's currently in a hearing. So, I'd also like to extend a thank you to our panel for joining us in this timely and important discussion regarding the cervical health of Black and Brown women as Cervical Cancer Awareness Month concludes. Each year, approximately 2,000 Black women are diagnosed with cervical cancer, and over 40% of these cases result in death. Black women in the U.S. are also more likely to be diagnosed with advanced cervical cancer than any other racial group, and are twice as likely to die from cervical cancer than white women. This disparity is not due to genetic differences, but rather is a product of socioeconomic factors and systemic racism in the healthcare industry. The good news is that cervical cancer is one of the most preventable types of cancer, and women can be screened for it with routine pap tests. Our purpose here today is not only highlight the threat that cervical cancer disease poses to Black and Brown women, but more importantly, to forge a path towards increased cervical disease prevention. Access to healthcare and establishing trust between Black women and their healthcare providers is essential to help reduce the cervical cancer mortality rate for women in our communities. The Tri-Caucus Health Equity and Accountability Act of the 117th Congress did just that. The legislation aimed to reduce racial and ethnic health inequities by addressing social determinants of health, improving healthcare access for underserved communities, and addressing the maternal health crisis. I am so proud to have supported this legislation that seeks to improve equitable health outcomes for all women, and I look forward to continuing this important work going forward. And with that, I want to thank Hologic and our wonderful panelists for lending their expertise and support for this event. I look forward to our discussion today, and I know this forum will provide us all with the valuable insight into cervical cancer prevention. Now I'll turn things back over to Mia. Thank you and have a great day.
Really appreciate you, Nisha. And again, we extend our gratitude to Congresswoman Yvette Clarke and all that she does in her personal office capacity for women's health, but then also in the collective through the Caucus on Black Women and Girls. Thank you so much.
Thank you.
As we know, what happens so many times, the staffers have to be on and headed to do their next thing. So we appreciate your time. I want to, before I introduce the panelists, just very briefly thank the audience members for being here, for your time. If you have questions that you would like for the panelists themselves to address, please drop them in the chat box. Otherwise, if you just want to respond to the things that you're hearing, also feel free to put all of that into the chat box. And without further ado, let me go ahead and introduce to you our phenomenal speakers today. We are really very excited to have with us Dr. Jessica Shepard. She is the Chief Medical Officer of Verywell Health. You might recognize her from various platforms, including the Good Morning America, the Today Show, MSNBC, Steve Harvey Show, or maybe you've read one of her works in Bazaar and Essence and a number of other places. But we're really very glad to have you here, Dr. Shepard.
Thank you so much for having me.
For certain. We also have with us the illustrious Tamika Felder, who is the founder and chief visionary officer of Survivor. You are in for a treat to hear her story. I'm very excited and appreciate you taking time, and new mama, right? And taking time to be with us today, Tamika.
Thank you so much for having me. I couldn't think of a better way to end Cervical Cancer Awareness Month. It's ending, but we still continue the work.
That's exactly right. And last but not least, we have our very own Dr. Sarah Harrington, who serves as our Director of Scientific Affairs. She is going to really break some things down for us in terms of where the science meets the road and why this matters in this space for Hologic and for many of our partners. Dr. Harrington, thank you so very much for being with us today.
Thank you so much for having me. It's great to be a part of this panel on such an important topic.
Absolutely. I want to go ahead and give you all the floor now that you have it. Tell us a bit about your work and the challenges that you see, why you do what you do. And we'll start with you, Dr. Shepard.
Great. Thank you so much for having me. You know, as an OBGYN, most of our training is with the reproductive system and how we can not only have women have better quality of life, but also use the tools that we have to prevent diseases and conditions such as cervical cancer. And even looking back 70s, you know, cervical cancer was one of the most cause of death from cancer from a reproductive standpoint for women. So we have come a long way with the advance of the PAP, but not only the PAP plus HPV testing that women have access to. And so when we look at the statistics that we see that there's 13,000 new cases of cervical cancer and 4,000 women are dying every year, we know that with the ability to have not only screening tools, but the ability that even if cervical cancer was detected at a very early stage, we actually have the ability, if not only to treat, but to cure when it's in its early stages. So when we have, you know, statistics that show that Hispanic women have the highest rates of developing cervical cancer, and then Black women have the highest rates of dying from cervical cancer, we can clearly see from that that there's a huge disparity. And we know that from one side, we have the resources and tools, and then we have this statistic. We know that there's a severe gap in where we're unable to reach these women. And so I find that it's important, you know, working with organizations such as Survivor with Tamika, but also using these types of platforms to have legislation and advocacy a big part of how we implement guidelines, how we implement education to communities that don't necessarily get the advanced type of education and systems that they can use towards empowering themselves to get to the doctor. If they do have maybe an abnormal pap smear or biopsy, to return to the doctor in order to get things that can regress the actual disease, or if they do progress to early stages of cervical cancer, to go ahead and treat and manage that in a way that they can have their lives.
Yeah, really appreciate that powerful opening. I think you left us with really very vivid thoughts just there. And I do want to segue to bring Tamika into the conversation to expound on what you've mentioned and to give us some additional perspective. Tamika.
Yeah, everything that Dr. Jessica said is really real. For me, being a longtime survivor at 20 years, I'm extremely blessed to get to this point in my survivorship and not really have any major issues. It doesn't mean that I don't have any issues, but my quality of life is as good as can possibly be, and I'm blessed. But I also know what it's like to hear those words, "You have cervical cancer," to understand that the morbidity for Black women and Latinas is at an all-time high. Today for Survivor, on the last day, we shared a graphic of just a few women who have died from cervical cancer. And I was really taken aback that here we are still adding women. And so for me, being diagnosed at 25, losing my fertility, but thankfully not losing my life, we know that screening saves lives. We know that screening is a powerful tool. And I feel like this is a safe space, and you invited me here. I'm going to keep it real. No one wants to wake up and say, "Oh my God, it's PAP day. It's the best day ever. I want to go put my feet in the stirrups." No shade to Dr. Shepherd.
I thought that's what people were saying.
I know Dr. Jessica takes extra care, but it's just not something we love, right? And I was one of those women. I wasn't going to get screened. There was a part of me for many years, I was so ashamed that I had brought this on myself because we have these tools and I wasn't utilizing it. But here's the thing, even though I was educated in so many things, I wasn't educated about cervical cancer. I wasn't educated about the power of screening tools. Now, going through my experiences and I mean, I had a radical hysterectomy at 25, followed by chemotherapy, followed by radiation therapy. And I am thankful for it all because it saved my life. But we want to get people before it's cervical cancer. We want to catch it early. We want to get them. And if we do catch it, let's catch it as early as possible. So my message to you today is that we need everyone involved to do this. I can share the story. Dr. Jessica can do her work. Hologic can do the work. But we need everybody involved, and we definitely need congressional support.
I feel like I'm going to be doing a lot of deep breathing throughout this conversation. Really appreciate you sharing and opening your story. We're going to break open your story a bit more as well, Tamika, and thank you so much for that opening. Dr. Harrington, please join the conversation.
Yeah, absolutely. And agreed. Thanks so much, Dr. Shepherd and Tamika, for providing your perspective. It's so important and critical. I work on it a little bit from the other side as a researcher and scientist in this industry, working at Hologic and our scientific affairs team. I spend hours and hours and years even focused on following the trends and data around the cervical cancer space. And it's really this kind of dichotomy of seeing, the impact that screening has had on incidence and mortality rates historically. It's the most successful screening program ever implemented, and yet we're not there yet. It used to be the number one cause of cancer death, as Dr. Shepherd said, and we've dropped that dramatically, and it's at the 15th most common cause. But, we still see, despite all these successes, we still see women diagnosed with cervical cancer each year. And really the red flag needs to be raised. I mean, we're talking about it today, disparities. We also are seeing a rise in cervical cancer in certain populations. This shouldn't happen. We do have the tools available, and we have to be mindful of that. And we have to continue having these discussions. Nobody wants to talk about it. Nobody wants to go for screening, but we have to in order to improve that education and really make that awareness and take away with the stigma of cervical cancer.
You all are using some really very powerful words. You said stigma, Dr. Harrington. Ms. Felder, you talked about shame, right? And Dr. Shepherd, you really opened up and talked about what you're dealing with, as a provider. I want to turn this over to you, as a provider, Dr. Shepherd. And as a person who is a Black woman, what does the intersection mean in terms of the way that you deliver care? How does your personal embodiment matter in terms of your own practice?
Absolutely. I think that's a very powerful question in the sense of me being a Black woman OBGYN. We're only, Black female physicians are only 2% of the entire physician population in the US. And so right there, you can see a little bit of the difference that matters. Representation matters. And I feel that one, as a woman, but then also as a Black woman, when we see diseases that impact specifically the reproductive system, I do find that in society, also in certain cultures, in religious backgrounds, that anything below the belt, as I like to term, really does carry a stigma. And so with that, you'll find various layers of how people show up for themselves or what they're willing to discuss. And that does, play a part in what they're actually going to discuss when they go to the doctor. Or, even Tamika was saying, getting to the doctor, like not even wanting to go. So there's a lot of various layers. I kind of call it like the Swiss cheese effect of where someone may not go or someone may go, but then not talk about the thing, or someone may go even as far as getting the PAP and HPV, having an abnormal result, but then not coming back for the follow-up. So you can see there's a myriad of different reasons why people don't necessarily want to have that uncomfortable conversation. So with that, being the provider on the healthcare provider standpoint, I find it's my ultimate responsibility to find those different barriers and break them down, whether it's with education, whether it's with being on these types of platforms to help people in legislation understand where those barriers occur and how they can be a part of that impact. And then when women come into my office and they do, I can sense that the shame and embarrassment that comes behind the conversation is finding ways to make it comfortable for them so that they can feel empowered to get the test, to want to come back if it's abnormal, and truly understanding actually from our standpoint, how much we can do if we get on the early end of diagnosing abnormalities on their PAP, HPV exposure, and or very early stage cervical. So as you can see, this is where we start to see some of the breakdown from various reasons from healthcare providers and patients of not making people feel comfortable about coming to the doctor to discuss possibly an abnormal test result, but also below the belt, taking away the shame from what it means to have an abnormal test, what HPV exposure means. It's a sexually transmitted virus. So people immediately go to, the social stigma of how did you get it and why did you get it? And those questions really don't matter at the end of the day. It is now we have the tools to diagnose, we have the resources to treat and manage. And that's really what's going to drive that number down. That's really what's going to decrease the amount of women that are dying. I have this question that comes to when I do media or talk to other people on platforms about cervical cancer is of all the cancer diagnoses that you could get in your body, we actually have something that could potentially eradicate the disease. And so with that really keeps me hopeful in making sure I bring that to the exam room when I talk to my patients, or bringing that to platforms when we have these discussions, because we have the ability to do it. And so I feel that with everyone's personal responsibility, social responsibility, and also healthcare responsibilities to find their avenue and how they can make that impact to drive this number down.
I really appreciate that, Dr. Shepherd. That was Tamika. It made me think of Tamika's word in terms of shame, right? I really I wish you were my OBGYN, because I'm sure I would feel really very proud to come into the room and open up. And rather than have a Swiss cheese situation, I'm more about provolone and cheddar. So let's keep it whole, right? But Tamika, tell us a little bit about your story, please, and everything from, what made you go to the office, to the doctor, to your doctor's office to begin with, what kept you from going, what made you go back, how did you feel when you heard those words, you have cervical cancer?
So when I was growing up, the guidelines were a little different, and I started getting PAP test around 18. And then before we had the Affordable Health Care Act, I was one of those college kids that got off of my parents' health care insurance. And I was working for many years as a broadcast journalist. Some jobs, they were health benefits, some jobs, they were freelance. And as a young 20-something-year-old woman, I didn't really care if the job offered insurance. Now at 47, I care what the offerings are. But then I didn't. I was just so happy to be in my career and doing my job and didn't think anything of it. Fast forward, I was about to start a new job, but I was still working freelance and I got this boil under my arm that had nothing to do with my cancer. But because the boil was beginning to be troublesome, it got me in to see an emergency outpatient facility. And so when I went there during the intake, the doctor just was asking all these questions, the nurse practitioner. And I remember thinking, like, can you just treat this boil so I can go? I need to sleep before the newscast starts at 5 a.m. And the doctor just said, you're a young woman, you need to make sure you have all these different things, checked off for screening. And I thought, okay, I'm starting this new job, I'll get health benefits. So started the new job, when I got health benefits, went in, was thinking nothing of it really. And this is why we also have to be in during our scheduled screenings. It's one thing if your body whispers for you or it screams and it tells you. It's a whole different thing if you don't feel anything or if you're not familiar with the symptoms. So I went in thinking, I'm just getting screened and it's going to be nothing. And that opened the door to this, web of go see this specialist, you have cancer. In order to save your life, this is what you need to do, and making all these quick decisions at once. And I went from this 25-year-old that had all this life ahead of her to thinking about, I'm going to have to tell my mom I'm going to die. She's going to have to plan my funeral. She's already buried my father. I can't do that to her. And there weren't a lot of resources at the time. So when, and again, we're talking about 2001. So I told you my age, even though I know I look fabulously young, but I literally was searching for support. I was searching for more information as a layperson, right? And what I was finding, and it was very minimal, didn't make me feel good. It made me feel like, oh, I was a bad person. I must have been sleeping around. I must have been doing X, Y, and Z. So now I don't want to go talk to a doctor because they're going to think these things about me. They're going to have these preconceived notions about me. So this is also when you hear about women of color not going in for follow-up. So those that do get diagnosed, the follow-up is very delayed if they go in at all because of stigma that is put on them from other people. But also we think that if it's not severe, it will go away. There's this thing in the community that people think that cervical cancer is an easy cancer. Oh, you just go in and get some cells removed, or you go in and you have a hysterectomy. And I will tell you, even those things, they aren't easy, not just because of the physical part of it, but the emotional part of it. So there's a couple things that we need to do. We need to make sure that people are educated. I want people to know, one, where their cervix is, what the function is. I want them to understand when they're going in to be screened for cervical cancer, what those tests are for, that PAP test, HPV test, what their doctors are doing. I want them to understand that if you have an HPV diagnosis, you can get that having multiple partners or one partner. For me, in this stage of the game of saving people's life from cervical cancer, it doesn't matter to me how many partners someone has. I actually wish people would stop honing in on that, because it is hurting us, and it is why those numbers are not going down. And in the United States of America, it is a travesty that those numbers are not going down, and we have these tools. I'm going to get on my soapbox. And I'm going to say that we all have to change that. If we want more women or people with a cervix to feel confident and go in and get screened and be empowered, we ourselves have to look at the language. I'm challenging myself and my survivor community, but I'm also challenging you all too, because if there's already a stigma, we don't want to continue that stigma, because when we continue that stigma, more people die of cervical cancer.
I was looking around and I don't see the reaction button, or else I would do the little clap in the corner. But just know I'm definitely clapping. You deserve all the soapboxes. Tell us a little bit before I bring Dr. Harrington back into the conversation about Survivor and the point at which you founded it, where that came from, that inspiration came from.
So when I started looking for support for cervical cancer, really, I was on the cusp of, 2001, diagnosed with cervical cancer, 2003, the first FDA approved HPV test, 2006, there comes this vaccine to prevent cervical cancer, now HPV, all HPV related cancers. And none of this meant anything to me, right? Because I wasn't a patient advocate yet. I was just a girl who went through this. And honestly, I wanted to go back to my life, never think about cervical cancer again. And what happened was I was sitting at my desk, working on different news stories, and I was pissed that no one was talking about cervical cancer. I was like, why did this happen to me? And no one's talking about it. Because every time I would go see a doctor or I would have a treatment, someone would say, don't worry, we see this all the time. And I kept thinking, if we see this all the time, why don't I know about it? Why isn't it in the news? Why aren't people talking about it? What is the color of my ribbon? I didn't know what the color of cervical cancer was. And not that it matters, but it does. And here's the other thing. When I did find stories of women who had cervical cancer, it was just a silhouette. It wasn't their face, and that's fine. I understand it. And so the broadcast journalist side of Tamika said, we've got a marketing problem here, right? We have these tools, but unlike other cancers, we don't have people talking about it. Now, I didn't want to be the person to talk about it. And so I understand when women don't want to come forward and talk about it, but someone's got to do it. So cervical Survivor was birthed out of that need for people to talk about cervical cancer, because I was like, if this is what happened to me and my cancer was caught early, what happens when it's not caught early? And then a light bulb went off, and I thought it could have easily had been me on the other side of it, that instead of telling my story, someone else would be telling it. People would be hosting memorials because I didn't make it. And if I can get up and breathe air in my lungs every single day, I'm going to be a part of making a difference. So I can't do everything. I'm not a doctor, right? I'm not a doctor. I'm not a researcher, but what I can do is share my story. I can empower other people to share their stories. And so that's what we do at Survivor. So it's one part support, and we share our stories, our faces, where we live, and all this other stuff. So you know that it's a real person. It's not a stock photo. But we also join with congressional leaders and other think tanks, and we lobby on Capitol Hill at the federal and state levels, because state levels matter also, to make sure that we hold our legislators accountable, and that they remember that we need more support, not only for cervical cancers, but below the belt cancers. So it's very important for us to make sure, remember us, see us, we're here, because it's easier to get lost in a sea of other cancers, and they all matter, but we want to make sure that we matter too.
Most certainly, yes. Thank you so very much for sharing that, and we'll have some time to speak to you a bit more deeply about your experiences right now post cervical cancer. Dr. Harrington, you talked earlier about trends with respect to cancer, and specifically cervical cancer. What are those recent trends? What are the changes? What are we seeing in the cervical cancer landscape, particularly here in the US?
Sure. Well, over the last 2 decades, we've seen a lot of changes in the cervical cancer screening guidelines in the United States. I think one of the biggest changes we've seen is the move from the annual PAP to screening every 3 years with PAP and every 5 years with PAP and HPV co-testing. In that same time frame, we've seen a pretty big decrease in screening participation. So fewer women are up to date with their screening than they have been in the past. And that's pretty concerning, specifically, speaking to hearing Tamika's story and hearing, some of the real outcomes of not screening. It's very concerning to see these trends in the bigger literature, and at the same time, after we've seen many, many years of decreasing rates of cervical cancer, we're actually now seeing a significant increase in cervical cancer in younger women under 50. And this sort of started in 2012. And so if you actually look at the data, it almost looks like a V shape where it was declining and now it's starting to slowly increase over time over that last 10 years. We also see, as we've sort of talked about earlier, significant disparities in incidence and mortality of cervical cancer across race and ethnicity. I think the most alarming, if you can even say one is more than any others, is that we're seeing a really significant rise in cervical cancer in young Hispanic women at an annual rate of 4% per year since 2012. That's shocking, right? I mean, we have the tools to effectively eliminate cervical cancer, and yet we're seeing it increase after many years of decreasing. We also see that the overall rates of cervical cancer are higher in Hispanic women, about 40% higher than white women, and about 30% higher in Black women than white women. And then, of course, again, Black and Hispanic women have higher rates of later stage cervical cancer. And that translates to higher mortality rates as well. Hispanic women being about 30% more likely, and Black women being 2 times more likely to die of cervical cancer than white women. This is, we're seeing that even the stage of cervical cancer is increasing. So we're seeing later stage cervical cancers that are clearly not being detected through screening. We shouldn't see people coming in with stage 4 cervical cancer, particularly, and as Tamika spoke about earlier, the success rates of treatments on stage 4 are dramatically lower than the success rates of treating a cancer that's detected early. So, we know we can detect precancerous lesions and treat them before they even become cancer, or we can, treat very early stage cancers very, very successfully. But as the stage goes on, it becomes that much more difficult. So, we're seeing a lot of really alarming trends here that we need to really focus on. And I think Tamika has been a wonderful champion. I thank you so much for all the work you do for sharing your story. I think it's almost a challenge of having a very successful screening program is that hardly anyone gets cervical cancer as a whole. And there are very few people that are willing to really provide their story and say, this is important. We are going to go back to where we were if we don't continue screening and we don't stay on top of our own health.
Well, I definitely want to thank you for that. One of the things that I was wanting to say earlier and I didn't say is that, here all these advancements have been made, but the problem that from my marketer's eyes was that where are the people sharing the stories? And so that's what I want Survivor to be. I want it to be an ally. I know that we have the stuff and we're always going to need things to come along and help patients, but I want people to feel empowered and know that their stories are making a difference, and they do. You talked about the rise in younger women. At one point in the organization, when people were still saying that it wasn't a young person's disease, we were seeing the trends because of the women who were coming into our organizations. And I kept saying, this is a young woman's disease. And again, not being a doctor or researcher, people were like, no, you don't know what you're talking about. And here it is. Now the data supports it. But we had the data coming in live with the women who were coming to us. So we all work together. We can make a difference. And we have Survivor Espanol. It is our leg of the organization that is dedicated to help Latino women globally. And we have some amazing ambassadors who are doing great work because we want to shift that number.
That's powerful work, leading with the stories as well as with the data, the quantitative and the qualitative right there. Dr. Shepherd, speaking of stories, how is it that you're educating and listening to patients across the age continuum who are presenting either with cervical cancer or just have questions about cervical health?
Yeah, I find when you start with the outcome of cancer, that's sometimes where your patients may not want to start with the conversation. And so I think starting with the conversation is a really good understanding of the reproductive system and how to be empowered by their, and that's starting with chipping away at the stigma. Because, Tamika was saying earlier, we can talk about the story and the cure and the treatment, but if we're not getting to the heart of why people may feel a certain way of not wanting to go to the doctor when they do, why they feel embarrassed to talk about their pelvis or their sexual history, and truly understanding what that means and taking away the context of sex, and sexual partners equaling, like it's not a strict equation of this plus this equals this. And I think that's what we have kind of created as far as messaging when it comes to anything that has to do with the pelvis, and specifically with females, because there are things that impact men and their health, but we don't always allude it to sexual activity, but we have done that with women. And so that's where I really try to take away the shame and stigma. Is it has nothing to do with who, when, where. It has everything to do with the empowerment, the education, and the ability for a woman to stand up and say, I'm going to be the protector of pelvis. And that's usually where I actually start the conversation is, I want to make you the ultimate protector of your pelvis. And here are some ways that you can do that. And then also, I take time, which is very hard to do as a physician because we're not given that time, but taking time to individually understand why they are feeling that way. Because if I just make a broad assumption, that again is not really tackling the underlying issue, and having people really divulge, one, forming a relationship, but then divulging why they may feel that way. That's how you get to the heart of that individual. And then you can move from there. And then it's much easier to educate and empower is when you start there.
That empowerment piece is really very critical for sure. And we're seeing that obviously in Tamika's comments. And then Sarah, data is empowering as well. I want to stay with the data conversation a little bit as we're talking about screening practices. What are the data saying in terms of the approach to screening? And if there are, especially if we're talking about younger people, are there any other modes of prevention that we should be mindful of or that people should take away from?
Yeah, absolutely. I mean, in the US, it's always been really difficult to run clinical trials that are representative of our diverse population. By nature, the studies that tend to be done are selective of patients that are very compliant to screening and willing to follow through for many years through several screening rounds. And we know that's not what happens in the real world. So we really, I think the most important thing is for us to really look at studies that have been published from the healthcare systems that look at data backwards to determine how screening tests are performing and how well those precancers and cancers are detected by screening modalities. So from these data, we know that PAP and HPV co-testing is the most sensitive in terms of detecting both precancers and cancerous lesions. And these, come from many different studies around the US because they're basically able just to look back through their database of patient data rather than trying to run a study prospectively. Looking at insurance data is where we see the data showing that patients are not up to date with screening. And survey data, which is really interesting, from some of the stuff that both Dr. Shepard and Tamika have said, survey data show that, knowledge is one of the main reasons given for not screening, and also access to care, not having insurance or, not being close enough to a doctor's office, these types of things. So it really does show how important it is to get appropriate education to these patients. In terms of other potential preventive things, of course, vaccination is extremely important. It will take some time for that to really get through the full healthcare system. We started vaccinating back in, I think, 2006. Those cohorts are now just starting to be old enough for screening. But, we do need to continue screening until vaccination really takes hold across all patient populations.
That's exactly the case. I want to talk a little bit about, the fact that cervical cancer isn't just something you personally deal with, right? This is also a family related, the impact is family wide, right? Or loved one wide. Tamika, you just became a new mother. What did having a radical hysterectomy mean in terms of you looking at your options to motherhood or building a family?
It took away my options. They're, in 2001, they had the technology for egg freezing, but it wasn't as robust it is now. and I was single at the time and throwing out things like donor sperm and all this stuff for this little Black girl from South Carolina. And I had my, religious mother with me, and she was like, huh, and you have to make these decisions quickly. And I really had an amazing doctor and team at Johns Hopkins who really, they were fighting for me, even when the insurance said no every step of the way. But not everyone has the same outcome. Another issue with cervical cancer, when we talk about health inequities, is that everyone needs access to great care. Everyone needs access to great care. I am here standing today as I am because I had access to great care. And I want that for everyone. And so while I am not able to have biological children, I was fortunate to have someone talk about the power of our stories in the survivor community. A fellow survivor donated her unused embryos to my husband and I. And so we have a 2-month-old son, Chayton Lennox Campbell, who is just the joy of my life. And I'll cry if I keep talking about it, but he makes me so happy, even though he's the reason why I don't have a lick of makeup on before this Zoom, because he needed some extra cuddle time so he would be quiet during the Zoom, and I gave it to him. But I'm blessed to be able to do it. So the one thing in that aspect, cancer didn't win. Cervical cancer didn't win in that aspect. I got to be a mom, and it doesn't matter that it happened way later. Cervical cancer didn't win that part of my story. And I am so grateful for that. I am grateful for every single person in my survivor community. When I speak of you today, I want to share these names with you. I want to share Jeanette Acosta, a Latina from California that was doing amazing work, Curtissa Clay from California, Net Cantanilla from San Antonio, Texas, Tia Lita Rickenbacker from Savannah, Georgia. These are women who should always be here, also be here, but I'll continue to share my story for them.
They are here because you carry their names with you in your heart, and you've shared them now with us, and so they are with us. So thank you for that. I want to ask if anyone wants to speak to the one of the questions from the audience about HPV vaccines.
I think what Dr. Harrington said was spot on. Vaccines are incredible. I mean, how amazing is it that we have a vaccine to prevent HPV-related cancers, but we still need to be screened because we have generations of people who will fall through the cracks if we only focus on vaccinations. And I believe in it, right? But we also have to focus on making sure that women are going in and they're getting screened, because we know that we have to change these statistics out here. And again, I'm not a doctor. I'll let the experts speak on it, but it's very important that we get that message out there.
No, I agree. I think it's super important. I think, it's a two-pronged approach until vaccination really uptake becomes higher and that cohort gets old enough to really go through the continuum of the years that we focus on cervical cancer screening. We see vaccination uptake is lower in a lot of places. I think in the US right now, we're estimating about 70% of adolescents have had at least one dose of the HPV vaccine. But we obviously need to continue to push that. We see disparities in vaccination rates as well. You can see disparities across states, all kinds of different things. So we do have to be vigilant, both on the vaccination side and on the screening side.
Couldn't get to my unmute button fast enough, silly button. Thank you very much for that. Indeed, Dr. Shepherd, did I cut you off just now?
No, I was just really going to add everything that they just said is exactly correct. And sometimes I just feel that I am so glad that the vaccine is here, but I always want to make sure that we stay focal, because that's what we do see is when we kind of change messaging all over the place and put too much in the basket, then people do get confused, even when we're thinking about recommendations for cervical cancer screening. So I like to stay broken record technique as far as like, get your screening, get your screening, get your screening, because that's where we're going to really see the impact that we need like right now.
Thank you so very much for that. I want to just give you all the same question here because many of our audience members themselves are advocates. I want to uplift the fact that we have survivors in the audience. Thank you so very much for being here. We also have people in the audience who themselves are congressional staffers and representing offices of congressional members. You know, what should be their takeaway when they are stomping the hills of Congress, when they're walking through state capitol buildings, when they're just going, you know, from family member to family member's house during holiday season? You know, what sort of policies, what are the policy takeaways in terms of promoting cervical wellness, or not even just the cervix in general, but all the conditions around cervical wellness? Dr. Harrington, can I open up? Oh, Tamika, were you going to say something?
No, I was just going to say everyone wants a win, right?
Yeah,
right?
yeah.
We're keeping it real here. Everyone is looking for a win, and this is a win. You cannot say this about any other cancer. We have the tools, we have everything, you know, more funding, legislating, yes, bring that in because that's important. More clinical trials for cervical cancer, all of that, very important, and it is needed. So unlike so many things that we go and we fight for, and it is an uphill battle, right? It almost seems insurmountable and that we can't get to the other side. With cervical cancer, we can do that, right? It's an easy win. And this is also something that is bipartisan, that people can come together. And so we really need to look at it that way. This is a bipartisan issue that people can come together, and it's an easy win to do.
Yes, I agree with you on that wholeheartedly. Dr. Harrington, what do you have to add to that?
Yeah, I completely agree. And I think, and echo what you're saying, I think it's super important for women, you know, all women to have access to screening for cervical cancer. And in order to maintain and expand access, it's really critical for us to continue to cover, you know, cervical cancer screening under the Affordable Care Act with no out-of-pocket expenses, right? We don't want to have people that don't have insurance trying to decide whether they're going to eat or whether they're going to get their preventive care. And so as the United States Preventive Service Task Force sets new guidelines for cervical cancer screening, I think it's really important that we try to maintain as much of, you know, all the options so that we're not doing anything that could potentially be detrimental to cervical cancer screening. You know, we really need to be focusing on getting women to get screened, making sure they're educated, making sure they have every possibility of having access, and not taking away any choices or, you know, doing anything that could potentially detrimentally impact screening.
Absolutely. Dr. Shepherd, same question.
I would want to add to going back to people and the fact that we have the ability, like Tamika said, it's a win-win for everybody. And cervical cancer is not, it doesn't have a predilection for, you know, who's going to get it, who's not. We talked about it earlier when we opened, is that the disparity occurs because there's an access. But in general, any woman who has a cervix potentially can get cervical cancer. So this is why this needs to be a widespread message to everyone and anyone, is that get your screening. We have the resources to decrease cervical cancer rates and deaths, not only diagnosing, but death. And so I think once we really focus in and be focal with that messaging, we can really have a really big impact. Even with, you know, amongst some changes and recommendations that may come, and hopefully they don't. But as a provider, for us, keeping it simple, getting to the root of the problem, for people in legislation, keeping it simple. This is a win-win. It affects and impacts all women. I think that's really where we're going to see it consistent. It's consistent messaging that's simple, and we can save lives.
I don't have anything else to add to that. It was fantastic. That was very well put. I do want to invite Dr. Jane Delgado, who is the president and CEO of the National Alliance for Hispanic Health, to give us some grounding remarks here. Dr. Delgado, thank you so very much for your presence, and we also appreciate your teal in the background there.
Well, it's been wonderful hearing from everyone, and I want to echo something that we all need to remember. Yes, today is January 31st, the last day of Cervical Cancer Month, but the beginning of the year. And our goal should be, what is a reasonable goal? We want to eliminate cervical cancer. We have the tools, we have the knowledge. This is not a moonshot. This is a putt. We can do it, but we all have to work together to do it. And that means that on the congressional side, we need to make sure that people have access to the vaccine, but just as sure that women can get Pap tests, that women's Pap tests and screenings are covered. Because for Hispanic women and Asian women, cancer is the leading cause of death for us. Cervical cancer should not be on anyone's list as a cause of death. We have come a long way from before, as Dr. Harrington said, when it was number 1, it's come down. It should be 0. That's our goal. That's what all our voices are saying. We have the tool. Let's get on it.
And our tools are legislative, our tools are preventative in terms of screening with both the PAP and HPV screening. Our tools are our stories, our tools are prevention and making certain that we're seeing our providers on a regular basis and that our providers are empowering us with really very hopeful information and timely access to care. Thank you very much.
Insurance covers
Yes,
it.
What's that?
The insurance has to cover it. You know,
Insurance has to cover it.
Hispanic women are the least insured. And also another important message to let people know is if you get diagnosed with a precancerous lesion, the treatment, the prevention is not what it used to be. For a lot of the Black and Hispanic women that I've spoken to, they're concerned because they saw how in the past the treatments were horrific. They're not like that anymore. The earlier we catch it, the better it is. And that works for all of us.
I love that. That was it's a lot to take away, I think, from everyone's remarks here today. And this has been quite the powerful mix. I trust and believe that our audience feel the same way. And so on behalf of Hologic, I want to just really say thank you to the audience members for your time, for your questions, for your continuous engagement. For those who are here live and those who will watch this later on, make certain that you remember what it is that you heard today from Dr. Sarah Harrington, our Director of Scientific Affairs at Hologic, from Dr. Jessica Shepard, the Chief Medical Officer of Verywell Health, and from CEO and Founder, Chief Visionary Officer, I should say, Tamika Felder of Survivor, and also New Mama. And finally, from Dr. Jane Delgado from the National Alliance for Hispanic Health as President and CEO. Beyond that, you all collectively are powerful within yourselves in terms of the stories you carry, the people whose names you say in your own head and heart when you're talking about being a survivor or being someone who unfortunately succumbed to cervical cancer. Just know that none of those stories will go in vain. We will continuously work at Hologic to raise awareness and to do what we need to do in the health and innovation space for women and their families. We are really grateful for the work of our champions on the Hill, through the Congressional Caucus on Black Women and Girls. Thank you so very much for representation today. And also through the Congressional Hispanic Caucus, we're really very grateful for the time that all of our champions in the congressional space have taken on both sides of the aisle. Once again, I'm Mia Keys. I serve as the Director of Government Affairs for Hologic. This will not be the last time we will host such a conversation. Make certain you come back and visit us another time. Thank you once again, everyone. Have a great day.
Thank you.
Thank you.